Yes, that's not what we believe. For us, regular periods is if you are having menses at least every month, that's regular periods. It doesn't matter whether they vary in the number of days. So normal periods range between 21 days and 35 days. So if you have periods this month, 26 days, next month, 30 days, another month, 32 days, we are okay as doctors. And that's not irregular. But irregular periods for us are periods which are beyond that 5 days and below 21 days. And these periods sometimes can even skip. You might, there are ladies who can have in a whole year 3 or 4 cycles. That's not normal. That is, there is a problem. And the biggest problem is what has caught news in the most recent, publications on social media. I've been seeing that, published in one of the biggest channel we call The Lancet, where we have always believed that people who have irregular periods have got a condition we call polycystic ovarian syndrome. What in the community you call hormonal imbalance. I know everyone knows that. But for us, it's a disease which we call polycystic ovarian syndrome. And this disease is basically, I'm not going to get into the depth of it, is associated with irregular periods or anovulation. Anovulation, we mean there are months you don't ovulate. So if a woman ovulates, if you ovulate today, 14 days later, you'll have your periods. If you don't ovulate today, your next period is likely to be less than 21 days or more than 35 days. And more important, there are people whose cycles, if they are at 21 days, we say they can be normal. But these people are also at another risk. When your cycles are short, there is a problem. It means when you are born with fixed number of eggs in your body as a woman. Every cycle, there are several eggs which die. So if that frequency is very close, you are killing, so not killing, so many eggs are dying, and therefore you are likely to end up in menopause, which we'll discuss maybe later, as a condition. You are likely to end up your reproductive life a bit earlier than the other people who have, wide space kind of periods.
Thank you. I think in today's world, most of the men and the female and the male gender, most of the people are struggling with infertility. And I think the myth out there is it could be due to age. Some even say curses. I don't know if it's true. But on a medical perspective, what is the general view on infertility and how we can best maybe reduce infertility? Is it food related? Is it age?
So, infertility, again, the community definition is different from the medical definition. According to us, you are only infertile if you've tried to conceive with regular sexual intercourse for a period of 2 years, if you are less than that 5 years. And regular sexual intercourse is defined having sex 3 to 5 times a week. That's our definition. The people who I meet in my practice, having had sex once in a month and have not conceived,
Yes.
they already come to see us that they think they are infertile.
Yes, women.
So I have to make this clear that you only conceive if you are having regular sexual intercourse. And regular sexual intercourse, as I have said, is 3 to 5 times per week. Now, that's infertility. Infertility is very common. In fact, the other day I was discussing with some of my colleagues. I underwent some training after I had seen the frustration some women were undergoing in our clinics here in MTRH. So people who think they are unable to conceive, when they come to the office, they are among the people who spend the highest amount of time consulting. First of all, they have needs, like you have said, which you have to devise. Secondly, they do not understand their reproductive health care system. So they have just listened in a salon, all they have heard from someone else, and carried a problem upon themselves and believed that they have a problem. Even when we tell them that you are okay, they don't move from their seat. They think like, as a doctor, you have not sorted their problem. I have seen that. And actually, we created a clinic in MTRH, voluntary. We run it like twice a month. I think the first Tuesday and the last Tuesday of a month. For this kind of women, because the consultation takes like 10, 15 minutes in one patient in a public hospital. That's too much time for one individual, while others are waiting outside. But you see, now I have to talk to you, get to know the history of your husband, get to know your own history, get to know your sexual history, get to know your medical history, and a number of things which contribute to infertility. Now, it's universally known that 1 out of 3 men are infertile. And it's equally known that 1 out of 3 women are infertile. And it's also known 1 out of 3, both combined, can be infertile. I hope you are getting me.
Yeah.
So that shows you that this is quite a great percentage. And why are we in that kind of situation? First of all, infertility has got a lifestyle component in it. The component is the food we eat, the diet. So, overweight, underweight sometimes can be a problem in infertility. Secondly, stress. The most stressed human beings on earth are women. And the reason is they are always having many problems to solve. Men are stressed, but their stress is that Arsenal may have lost. Man, you may have won. I mean, you've seen, you yourselves. But I see nowadays a lot of women have joined such ways of managing the men's stress, the simple things, yeah? The other thing is smoking. I know you guys don't smoke, but you are smoking passively outside here, especially next to our church here. Yeah, and those who actively smoke. The other thing is caffeine. Caffeine is, tea, coffee. Those of you say I need very concentrated kind of coffee that can affect your fertility. And then there are other medical factors, chronic diseases like if you are having a chronic disease like TB, diabetes, and many other things can have that effect. Besides, cancer treatment, if for some reason a woman has cancer or a man undergoes treatment, they can get infertile. And if you've been operated before, I do not want to scare you, but if surgery has been done on your ovaries, sometimes it might be a problem. But the leading problem that we have in our setup on infertility is what we call tubal blockage, which arises from infection. A number of times again, the community believes that sexually transmitted infections cause the tubes to block. That's true. But sometimes you can get those infections without being sexually transmitted. Every time a woman has her periods, it means there is communication between the inside of the uterus and the outside. And at that particular point, there is a small risk that the barrier which prevents the infection has been overdone. So there is that chance. Then there are other many things for men. Men, those factors we have mentioned, plus, maumbile genetics. There are men who, the way they were born, they have got an issue. And also there are women. Now women, you can be, the way God created you, some people have got issues to do with their anatomy. There are things we call like agenesis. I mean, there is no vagina, for example, or there is no cervix up there, or there is no uterus, or there are no ovaries. I mean, there can be any of those problems along the way. I think there's so much to talk about.
There's so much to talk about. Yes, exactly. And I think where I come from, majorly, the women usually carry the blame of infertility. But we are here to gain knowledge and empower the rest.
Just to comment on that, the current WHO guidelines and what we call the Congregation of Gynecologists across the world, we are advocating that when we are evaluating for true infertility, we need both partners together, and we should begin at the same time.
Okay, that is nice. So I don't know what's your advice on secondary fertility options. I think there are very many secondary, how you can maybe conceive.
So secondary infertility means that when you may have already gotten a child, you are waiting for your next child, but you are not getting pregnant. And maybe, again, you are meeting the criteria that I gave earlier on how to conceive. So the secondary infertility arises from many factors, some including what I've mentioned, including infections. But what we are quietly noticing, including, the endometriosis and the rest, we are noticing that, I have a match like we like cesarean section. Most women feel like it's trouble to deliver normally. Anytime you go through an operation, healing as a process can be smooth if you are lucky. It can also be rough. When it's rough, the inside heals with what we call adhesions. Adhesions means you'll get like the tubes, the ovaries, the intestines, they can get attached on the surface of the uterus. And with that, they can be blocked. So sometimes we have that, but also secondary infertility in the reproductive age has other components like fibroids, adenomyosis, and other things. And one of it, which is now currently coming up, is what we call a cesarean section niche. Depending on who has done your cesarean section, sometimes, and it's not a deliberate thing, you can heal, but you can heal with a communication between inside and the surface of the uterus. And such patients, we've noted that they can, even when you conceive, you likely maybe even to have complications with your pregnancy. We consider that like an ectopic kind of pregnancy. Yeah, but we do not have ways of preventing it other than the very basic ways of, proper, infection prevention, because it's a leader. And then proper surgical techniques when you are being handled in theater.
Yeah, thank you. And Daktari, we've been seeing stories of women, maybe there's a lot of maternal deaths, maybe during pregnancy, when someone is giving birth. I don't know, what are the early signs or the signs that we should look up so that we don't fall victims also? What are the serious signs? Maybe is it when you look at some signs, you run to the hospital, at least you can now call a doctor when you look at those signs. Are there signs that we should look up for during that process of during pregnancy and when you're approaching now giving birth?
Yes. To me as a doctor, pregnancy is a disease. To you as a community member, pregnancy is a blessing. So
Yes.
we look at these things in different ways. Why is it a blessing? It's a cultural thing for you. It's a spiritual thing. I mean, it's expected that every woman can get pregnant. To me as a doctor, every step in your pregnancy, I see your life slipping out of Africa. And the reason is, you can't be very okay. But for example, patients who are having their first pregnancy, these are even the most careless one because they listen to so many people that one time, I don't know whether you are one of my patients here, but don't take it badly. A patient came and told me, Nico Napol, being a very
Yes.
being a very old person. I've practiced
Yeah.
medicine for 20 years. I had not heard of that. I had not understood what
Yes.
that was, yeah. But after my patient insisted, then I want to understand what she was talking about.
Yes.
But this patient was seeing us in the clinic when she is able to appreciate that there is a bulb, yeah, which is very wrong. Because by then you could be dead. This is the reason. So immediately you conceive, 2 weeks after you miss your periods, ideally, you are supposed to see us.
Yes.
We are supposed to do an ultrasound. And the very first thing, confirm that you have a pregnancy, what we call viability. And secondly, determine that the pregnancy is in the right place.
Yes.
If the pregnancy is in the wrong place, you are on your way to death. If it's ectopic, the ruptures, you bleed, shock, death. So death can begin as early as immediate 2 weeks after you've missed your periods. That's how dangerous it is. Secondly, these pregnancies which are of later age I mean after that 5 years and very early, maybe say less than 20 years, have also other risks. I'm not saying the ones in between they don't, like high blood pressure. So the reason why we keep on, some of my patients tell me, hey, I hope I'm coming for the last clinic. I mean, the lady's already assuming that everything will be
Go well.
okay,
Yes,
everything
yes.
will go well. It doesn't. That simple act that you come to the clinic, we check your pressure, we listen to your story, we ask you, are you having headache? It's not that we just want to be paid some consultation fee. Yeah. Are you having a gastric pain? Have you seen like your limbs are swollen? Is your face swelling? Are your hands swelling? I mean, have you realized that your urine is becoming littering amount? The questions we usually sometimes ask, they are very important because we do not have another way of saving, for example, a woman from high blood pressure in pregnancy, which is among the leading killer. And this one can kill you within 1 day. For example, last night, I had a patient, and I'm not mentioning her name, so that is confidential, whose blood pressure was 230 over 150. That 150, it's the lower minimum is supposed to be below 90. Almost twice, yeah. And I met this patient at a time when she was almost having a stroke. She's telling me like that there is something I'm feeling, I'm not seeing properly, all those kinds of things, yeah. And her pregnancy was around 30 weeks. So unfortunately, we lost that baby because of that high blood pressure. But one thing I want to say, one of the most leading killers is high blood pressure. And the easiest way for us to detect this is by you obediently attending the clinic.
Clinics.
A woman can equally die after birth from bleeding.
Yeah.
We are currently serious campaigners, and I'm going to ask excellent women
Yes.
this September we usually do an awareness campaign on postpartum hemorrhage. I will request, I'll talk to Pastor Patricia, that
Yes.
you guys find an opportunity, to participate in that campaign so that we make people aware.
Aware.
Yeah.
Yeah, thank you, thank you. Now we move to sexual health in marriages. That is a topic that is very difficult for our women and our marriages. So maybe as a woman, how best can I maintain my health reproductive wellness in marriage? Just generally, how best? Because I think that is a major issue in our marriages, breaking most marriages. So how best can we handle this?
This is one of the most difficult consultations for me
Yes.
in the clinic because it's a very emotional thing.
Yes,
And
yes.
I'm not a marriage counselor.
Yeah.
I'm a doctor. The only approach I can use is science in relation to how I got trained. So when a patient is seated before me
Yes.
and they have issues to do with their sexual health, sometimes we listen and we realize that there are it's myths. Okay, let me give a very funny example.
Yes.
A man came in my clinic. Is everyone married here or there are people who are not married?
No, there are people. I think we are all. There are some who are not married,
There are
but they are
some-
preparing for marriage.
They are preparing for
Yes,
marriage.
yeah.
So this man tells me that, I think what he had had,
Yes.
that, let me use the language he used, not my language,
Yes.
that I go 7 rounds
Uh-huh.
and I'm done.
Yes.
How will you respond to that? Isn't that a very perfect person?
Yes, that's a perfect person
Yes.
from my view.
Yeah. So then I asked, why are you here?
Yes.
Because from my understanding, that person sounds okay.
Yeah, yeah.
But the society, the social understanding of those things are different.
Exactly.
We do not have a school where we are taught about what sex is.
Exactly.
So 7 rounds for this guy, it's like doing press-ups. That is his interpretation. After digging deeper,
Yes.
that's what I got. Yeah. So another man comes. I also see men because of these issues. Another one comes and says, after the act of sex has begun, I can hardly last 10 minutes. Is that a patient?
Yeah, that's a patient, I guess. Right?
Now, you see,
Yes.
that's the society definition. Are we together? But the medical definition, we do not agree. That guy is
Okay.
normal,
Wow.
according to us. But you see, because he has believed in that, it has affected him. He no longer looks forward to sex because of what he hears from other people. So the thinking in this guy is, I'm abnormal.
Yeah.
So by the times, from arousal, erection, ejaculation, which are normal stages of sex, literature and the studies done show that a man who ends up on ejaculation between the 4th and the 9th minute, that is considered normal. So do not set your men to win
Too
Champions
high.
League.
Yes, yes.
Try to understand it that physiology dictates. So sex has various stages: arousal, erection, ejaculation, and the resolution. So again, those who see me, let me talk about men because you are the guys who send them.
Yes.
Yeah. Those who see me also say that they come, of course, when they ejaculate, they go flat. Are they normal?
Yes. Right?
Well,
No. Someone is saying no.
Yes, again, you are wrong. So when you can Google the various stages of sex, is that after ejaculation, even after orgasm for a lady, what follows next is what we call a resolution. Resolution means,
okay.
the whole process goes flat. Be it for the woman, be it for the man. So all these things exist, and a lot of problems you face here in church.
Yes.
Sometimes they are true situations.
Yeah.
Sometimes they are myths. I mean, the way people understand things in their own.
Yeah.
But they are true sexual disorders.
Exactly. Yeah.
Among the true sexual disorders is, for men, is premature ejaculation, unable to erect completely.
And
which
I
is,
think that was my next question now.
Yes.
On male erectile dysfunction, what is the main cause? And now as a woman, I'm an excellent woman. Yes, my husband has that problem. How am I going to handle it? How can I support him?
So erectile dysfunction can be a really issue. But when a man has erectile dysfunction, that man can easily disappear from the house, can easily find comfort in drinking, can easily find something else. If they are not well groomed, they can get into alcohol and all other things, and they disappear from you, and you'll keep complaining. Yeah. The issue is that man needs support, and the support the man needs is first understand and agree that there is a problem. Men, their ego is in such a way that they do not want to be told that they have a problem. But the approach here is they have a problem. It could be metabolic. Some men have a lot of weight, obesity. So that can be an issue. And I've got medical metabolic conditions like diabetes. Those are things which can be treated. Some other men have got heart conditions. There are men, if they have sex, they are just a few seconds away from dying. Because when their heart pumps very fast, the next thing is that somebody can collapse on you. Yeah, and that needs to be understood. Yeah. Some other people have actually true problems. They have low testosterone levels in their body. And all these are medical issues that can be reversed and sorted. So for the excellent women, then my thoughts are, all that you need to do is just support your man to go to the hospital and be treated. And there can be also psychological elements like the ones which I have mentioned.
Yes.
People are watching Arsenal and they are saying how they are serious champions. And
yes.
You are already counting that you are relegated to Division 2.
Yes.
So then there can be also a very big challenge on that. And under such situations, then the best thing that should happen is to have this person taken, be evaluated. When they come to us, we'll check their heart, we'll check their blood sugars, we will check everything to be sure that they are safe. Do not push them without being checked to start swallowing what we call the blue pill. The blue pill is the reason why we have also lost a number of men in
ladies,
this country.
I hope we are keen on that.
Yeah. I think that is it.
Okay, thank you. Thank you, Dr. Harry. Women don't like giving their age because, we get scared a bit of aging. But maybe you can mention about early menopause. What are the signs? I think from my interaction with women, some of them would say, unasikia joto kidogo. Now, you can give some signs of early menopause you can mention. Maybe someone is wondering what menopause is for the young ladies. You can mention on that, then we can pick up from there.
So, let me make a general statement before I come to the specificities on menopause. I had earlier mentioned that you are born with a fixed number of eggs.
Yes.
So as you age, nowadays we are encouraging women actually to take count of their age and also make decisions alongside their age. There is a very good reason why. In Spain, where I underwent my training, and generally in Europe, most women have become very empowered. They are going to school.
Yes.
And they have developed this kind of attitude against men. They do not see how important they are. I don't know whether there is anyone who shares the same feelings like that.
Yeah.
When you are in a European country, you know, when a woman, if you go to a conference, all leaders are women generally. I mean, they are not men. When you are electing the president of a society, 15 out of 20 council members
Are women.
are women.
Yeah.
So what has happened in those nations, these women, I mean, the whole aspect of marriage is, it's not the realistic thing that happens here in Africa. So everyone is moving in their own direction.
Yeah.
You only get a child if you so wish. You might not even get that child. But what they do, like in Spain, women when they are of age, they are, you know, in their 20s, they go and they get their eggs harvested and stored for fertility preservation. I will
Yes.
not want to encourage our African women because still, I think still marriage as an institution exists in
Exactly.
Africa.
Yeah.
And actually people admire the way we live in Africa. So do not admire them that much.
Mm-hmm.
Then what follows there next is as you age, your eggs, every time you have a period, your eggs are getting depleted.
Mm.
By the time you are 35, you are in 10,000. And that decrease goes very fast. When you are in 40 years, you have very few eggs. You are in the tune of thousands. 42, 43, 44, you are in tens. And then that's the period we start now calling perimenopause. Perimenopause eggs are the rationale behind your estrogen in the body. When the eggs cease, I mean when you are not ovulating any longer, then it means you're getting into menopause, and then estrogen as a hormone, which defines you, like I mentioned earlier, goes down in terms of levels. So perimenopause then communicates in many ways. The first communication is irregular periods. Periods start like they are disappearing. You can have once in 3 months, then 6 months. If you go a whole year without periods, if you are from 46 to 52 years, then we say you are getting into menopause. But that disappearance of periods does not come without a cost. The body responds to that absence of estrogen in many ways. One, it responds through, you know, signals to the body. What you guys know we call hot flashes.
Yes.
The body becomes, you know, it's like when my patients talk to me, they say, ni kama umewekelewa jiko na ikatolewa. Yeah?
Yes.
Then the other way they bring it out is that they are unable to sleep. They are psychologically disturbed. I mean, there are
Yes.
many other things. They can increase in weight. Their health now becomes a problem.
Yeah.
Even apart from weight, they start developing blood pressure. The quality of their bones become weak. Their face changes. You know, we define all the people by looking at the wrinkled
Yeah.
face.
Yes.
Yes, that is part of how we can define menopause. But the other very distressing thing is that their membranes, especially the vaginal wall, becomes dry. And even the urethra, the pathway through which urine passes, it becomes very dry to the extent that some can feel like when they are going for short call, it's painful. It's because it's passing through a dry path. And
Yes.
even your sexual health then becomes a challenge. And then because it's dry and it's painful, then even naturally your sexual libido
Yeah.
goes down.
Yeah.
So there are all those kinds of things and many more which can be mentioned.
Yeah.
But the other ones are quite metabolic in terms of your heart health and your general body health.
Yeah, I think, Dr. Ari, thank you for that. And I think out here we are getting supplements that people sell to also stabilize the hormonal imbalances that are happening at that period. Do you really advocate for that? For those
So
supplements, or are they medically proven?
Who is the consumer of those? Is it
Yeah.
the menopause women or?
Menopause, yes.
Okay, fine. I think in our African setup, menopause is a very frustrating condition to manage.
Yes.
We have actually seen people who get depressed and they end up in psychiatric units because
Okay.
of menopause.
Yeah.
And the reason is you are unable to be yourself. I hope you understand.
Yes.
And if you do not have a very good supportive kind of environment, and I'm happy, that we have excellent women
Exactly. We have the
here.
support.
Then excellent women should be able to support their women.
Yeah.
If you are not well supported, you can actually mentally become sick. It's a risk factor for mental illness. Just like I didn't mention earlier, that even periods alone can be a source of mental
Yes.
illness, especially if it's very painful. And also, if there are people who experience some mental issues every time they are going to have their periods. Let me put it bluntly like that.
Yes.
So I want to say that in our setup, the biggest issue is we rarely do hormonal replacement therapy, even if it can be done. The reason why we do not routinely do it is because the effects of hormonal replacement therapy, they include, your heart problems, hypertension, and even other issues.
Yes.
Our patients, our health-seeking behavior is very poor. Once you've been introduced some medication, people want going through over the counter to get the drugs. They ignore their doctor and they treat themselves. And yet we fear giving medication, which we are not monitoring. And therefore, most of our women, because of that, are suffering the serious effects of menopause.
Yes.
Just because of our health-seeking behavior.
Yeah.
So some of those agents, if given, can cause cancer.
True.
Some of them, high blood pressure. Some of them, several other gynecological conditions. So most of our women then, which is the easiest way to go about it? Sometimes personally, as a doctor, I find it easy to give some of those supplements, but those ones which have been processed through the normal system. Now, the problem I have with the system you are talking about are guys who have chosen to do some business.
Yes.
Sometimes we do not know. They write a million things that they are supplying. But when I look at it, I do not know how this company is able to manufacture a drug which contains a million things.
Yes.
I mean, but somehow you have something to swallow. But but for us, I think we have a few, the only source of estrogen, because menopause is absence of estrogen. The only source of estrogen, which can be found, all animal protein does not contain estrogen. It's only the one plant we call soya. I go to a church where people associate us with soya.
Yes. Yes.
So do not wrongly get me that I'm marketing.
Marketing soya. Yes.
I'm marketing soya.
Yeah.
But the drug we have in the market is called Isoflav, for example, or Menopause. There are guys who have come up with those drugs. But what they have there is phytoestrogens. Phytoestrogens is the plant form of estrogen.
Yes.
So it could be okay if I knew what we are consuming, but it can also be wrong. But if you're taking the right thing, we do that. But that's not what is needed. There's a lot that's needed in menopause, including the support I've talked about, and also more important, if it has reached to the level that you can't sleep, there is a psychological element that needs to be taken care of, even true treatment.
Yes, yes, yes. Thank you, doctor. And I think also for the women, there are insurances that are currently covering those supplements for menopause women. So, and I know most of them will adopt coming in the coming future. So be encouraged. Don't take those pills from the market. I think you should. As we move to our last question, Dr. Ari, how often should we visit a gyna before marriage, after marriage? You know, how frequent should we come? Because I know most of the women, not here, usually visit a gynecologist maybe when they are pregnant only. After that, no going back there. So how frequent? And maybe some of the screenings that women should go through.
So I will not define how frequent you should visit a gyna, but a year should not end before just seeing a doctor.
Yes.
On the basis of your general body health, even before we discuss about the gyna. But you see, you should also see a gyna to ensure that your reproductive health system is up to date.
Yeah.
And I mean, the experiences you are going through are okay beyond ChatGPT and also
Yes.
beyond your other friends in the salon.
Yes.
And I mean, we know beyond what everyone says. A number of times when you hear people say some things, like, let me say, the other day I had a young girl in my clinic. Her greatest, and she's in high school. I mean, probably all that she needs is emotional support. She has not had menses for a serious anatomical issue. But that thing is disturbing her to the level that school no.
Yeah.
You understand?
Yeah.
And when I evaluate her, I realize that actually it's not something that we can sort.
Yeah.
And the next step is, I look at her like my daughter, and then the feeling is, this girl needs to concentrate on her education.
Studies, yes.
How do we deviate her from that?
Yeah.
So, as soon as a young girl is born, they need to have land on the hands of a pediatrician.
Wow. Okay.
And do a full anatomic assessment.
Yes.
There are babies who are born and they are born with anatomical problems.
Yeah.
I mean, there is no vagina, there is no anus, you understand what I mean.
True.
So once your child is born, seek to understand that your child has been evaluated. Even when you see the pediatrician is not paying attention, ensure that the midwife, all the gynecologists have paid attention to the anatomy of the child.
Yes.
So you see already, even before you land, you are supposed to be seeing the doctor.
Yes.
The next is, periods begin in a very complex way. They don't begin smooth. Yeah, some they can begin, and those make the minority. They begin regularly and things move well. If you get to 16 years and you are not seeing your periods, we are saying you need to see the gynecologist.
Yeah.
We need to check and see whether there's a problem. Yeah, and we have already said if your periods are usually painful, it's always good. If you are in school, they used to see matron, but we are discouraging that. See a gynecologist so that we are able to define why you are having pain.
Yes.
If you are having, because the greatest story in the Bible about a woman who bled for how many years? Past 12. When you go to the Bible, has her name been mentioned?
No.
Why is it so? I suspect it is because of these privacy issues.
Yeah.
I mean, she was being protected. Just like in those 12 years she suffered,
yes,
she made her reproductive system private.
Private, yeah.
For how many years? So there are many people, and I'm not saying here, these are excellent
Yes,
women,
not here.
who are suffering, but they have not sought to get an opinion as to what is going on, whether it's okay or not okay. In my thinking is, even what you've had, generally speaking, these judges, There are no more discharges. There are a number of you who have swallowed antibiotics across the counter
Yes, yes.
so many times. And you come to us when you are saying, I'm not recovering. You know what you are doing? Every time you buy antibiotics over the counter, you kill the normal bacteria. The vagina, the mouth, the ears, the nose have what we call normal flora. All these organs, the vagina is connected to outside.
Yeah.
They communicate to this world.
Yes.
So when you kill the bacteria which resides over there, the antibiotics don't kill yeast. So every time you swallow antibiotics, oh, niko na homa. The next thing is a white discharge, kuchikuna na vitu zingine.
Oh, okay.
So why not get the proper treatment? Excellent women should be able to get the right diagnosis and treatment.
Yeah.
And then, you know, once you have a white discharge, you say, maybe this is my pattern. Now, some come alone. Others, sometimes they frog match their partners.
Yes.
And you know, a number of times men keep quiet.
Mm-hmm.
They are accused
Yes.
of some things. And sometimes you bring down their ego and actually spoil their appetite
Yes.
for your coexistence. So it's good just to seek, you know, it's good to seek proper medical advice.
Yeah.
But generally speaking, there are other things which are now a must. For example, you are showering as a woman. You are in the house. Before you put your bra, isn't it so embarrassing that some years later, you have a growth here,
Yeah.
which you've never even put your hand
And checked, yeah.
and checked on yourself?
Mm-hmm.
I mean, even before you come to us, also be excellent about your own health.
Exactly, yeah.
Secondly, we have said that if there are women here, and excellent women who are already who are not sexually engaged, then you have a very big opportunity to undergo immunization against what we call human papillomavirus, the virus which causes cervical cancer. But even if you are sexually active, you can undergo what we call HPV testing.
Yes.
And then your doctor can make a decision whether you can get that vaccine.
Vaccine, yes.
But if you are already sexually active, you've gotten children and you are 25 years, 49 years, or to wherever God will allow you to live, it's also good that every at least 3 to 5 years, I'm saying 3 to 5 years because hata kama umesahau na imefika miaka 5, we will be able to pick something that we can help be screened for cervical cancer.
Yeah.
Stop all those things people saying, you know, I see on social media, TikTok, where people are just spreading the speculum. It looks like, you know, this is what they are going to put in me. No, ignore all those things. Surrender yourself and discuss your fears with the doctor. If you are uncomfortable with the speculum, say you are uncomfortable.
Yeah.
What can be done? I mean, you have a chance to tell your doctor what your thoughts are about.
Yes.
If you have a condition we call polycystic ovarian syndrome, I mean, your periods are irregular, and you've probably not been seeing the doctor because a doctor will tell you you are at risk of, if it's not managed, you are at risk of what we call endometrial cancer. Endometrial cancer is not necessarily screened, but can be picked earliest.
Yes.
And the earliest it can be picked, it communicates through abnormal bleeding. Because the inner wall starts enlarging, and the first thing that happens is you start experiencing some form of strange kind of bleeding.
Yeah.
Get to the doctor, they will do what we call endometrial sampling. They'll be able to tell you maybe you are in precancerous stage.
Yes.
There are other cancers which we are unable to screen. But again, if you see your doctor, say annually, as a gynecologist, they might be able to pick it. For example, cancer of the ovary. By the time you get it to the doctor, it will have already consumed you to a larger extent.
Wow.
Because the ovary will grow and fill the whole of your tummy. And at that time, you present the only thing probably bringing you to the hospital is your enlarged tummy.
Yes.
And also satiety. I mean, you feel like you're always full, and maybe even constipation, because if the cancer has gotten into the intestines. So there's always a reason to see the doctor. But when you are pregnant, see your doctor immediately you miss your periods, at least 2 weeks later.
Yes.
See your doctor at 12 weeks. 12 weeks, we mean you finish the first trimester.
Yeah.
You guys, those things you tell me, oh, walinipima clinic, hiyo sio kupimwa tu. For example, when you come and we do those things we write in the book, we are setting you on a good pace. Why? If, for example, once you finish the first trimester, during the first trimester, most of our drugs are unsafe in pregnancy. Once we have finished the first trimester, we are screening you to identify any condition which can have an effect on the baby. And because the second trimester from 14 weeks thereabout, most drugs have started becoming safe to be used in pregnancy. You have HIV, we can treat you. If you have hepatitis, we can treat you. If you're having UTIs and all those things, we are able to give drugs without any problem. If you are having any of those conditions, TB, name all of them, we are comfortable to treat you. At 20 weeks, we are able to tell what you are carrying, whether it's a normal baby or abnormal baby. Now, this I have to mention because during introduction, you said I had you struggle mentioning the word fetal-maternal.
Yes.
Yeah, yes. And it's understandable. We have a fetal-maternal unit in MTRH. Some special types of ultrasounds done for women who are at risk of developing abnormal babies. So you are at risk of developing abnormal baby, number one, if you have a medical condition. You have a thyroid, there is a risk that your baby can be abnormal. You have diabetes, there is a risk that your baby can be abnormal. You have hypertension, because we are using several drugs to treat you, you have a risk. You have, what have I not mentioned? I mean, quite a number of medical conditions. But equally, your age alone can be a risk factor for us to send you to be screened. The reason being, from latest scientific studies, women who are very young, I'm not discouraging those who are below 20, around there, going down. And the women who are above 35 years, we have noticed that actually they are at risk of chromosomal abnormalities. They are likely to give birth to babies. I'm not saying in between, the risk is high. In between here, there can be, but the risk is higher in those ages. The argument is below those years, it looks like, your eggs have not, gotten the character properly. And towards the end, the quality of the eggs decrease. And that becomes a challenge. So generally answering your question, as a gynecologist, I'll be happy if you see me every month.
Yes.
But I might not have so much to offer if you see me every month. But if you have anything that you are not sure, please see. If you have been identified with a condition that you are unable to explain clearly, do not Google. Come so that we are able to tell you what your problem is. But at least once a year. Even when you have no problem, walk there and have a general discussion with your gynecologist. He might remind you to be screened. And they might guide you on something else that you need to do. Or she might, sorry.
It's both. Okay, thank you so much, Dr. Ari. Thank you, excellent women, for being patient. Before we close, any questions from the excellent women? Just two. I think we'll give two because time is not on our side. Oh, there's a lady there.
we take more questions?
Yes,
before-
maybe another one. Then Daktari can handle any other. Yes. Okay, thank you. I hope there's no other burning. Daktari can handle that for today. Yes, Daktari.
First of all, a disclaimer. I'm not consulting here.
Yes, that's what I was about to say.
But I can be available privately.
Yes.
Even if it's contacting me, I can address some questions, because before we make conclusions, this is how a doctor works. So nowadays, you guys come to our clinics with diagnosis, which is very wrong. And sometimes you've read internet, you've made a diagnosis, you've even walked to a radiologist, done an ultrasound by yourself. And when you land in my office, the first thing you are putting on the table is the
The
paper.
Google results.
The report from ultrasound, which is actually most of the times normal. So I will not even try to. Many times my patients feel like I'm a difficult doctor because I refuse to take that paper. And there's a good reason why. Before you arrive at a diagnosis, the way we are trained as doctors is that first you must take history. History is, what exactly, why have you come to the hospital? Yeah, there is that thing which brings the patient to the hospital. We go ahead and ask, what is your past medical history? I mean, have you been operated before? Do you have any chronic medical conditions? We ask those questions for a reason. You already had. I said that if you have you had an operation, sometimes it's even a risk factor for infertility. Yeah. So it's also always good for me to have all that documented down. Yeah. And then family social history. For example, smokers are likely to end up with dry vagina and something like that. I'm not saying you are a smoker.
Yes.
Using a why it can be difficult, but I have to talk generally, yeah?
Yeah.
And some medications that we take can also lead to that. That's why I'll ask about what's your chronic, if you have you are having any chronic medical condition. Sometimes they sound very basic questions, and we ask them very fast. If you are not prepared to tell us exactly what it is, if you are casual in terms of seeing your doctor, sometimes you might not communicate what your problem is. Yeah. But sometimes we try to guide you so that you are able to say everything that we need to put together. And even we will examine you and see whether there is a problem. And even when we examine you, nyinyi mnaanza na ultrasound, we will determine which test you need to do.
Yes,
after examining you.
Yeah.
And when that test comes, we'll try to correlate it. In fact, some radiologists correlate with your clinical findings.
Yes.
So that, I'm able to make use of your history. I attach it to what I'm seeing on this paper. So however much technology has moved, it will not replace the doctor. Your doctor will always be available for you.
Yeah.
So there are many things which can cause, dry vagina. Truly, the cycle of a woman is a very complex thing. Yeah. A woman can have discharge throughout all their cycle, but they are different discharges.
Yes.
I mean, if you look at it critically, just when you are having periods, call it a discharge. Immediately after that, your vagina has to cleanse itself. Yeah. So you'll have something brownish. After that, because of the hormones along that cycle, you'll have something like a watery discharge. So depending on the hormone which is predominant, and depending whether you are also using other medications.
Yes.
it's possible that your vagina can be dry at a particular point. But generally speaking, what makes the vagina wet is estrogen as a hormone. So if the estrogen is overpowered at any time and it's low, like I mentioned before for menopause patients,
Exactly.
then there's a likelihood of that. And also the way we take care of our hygiene. Some of us are too ambitious. We are not supposed, we need to reduce the ambition for the reason that the vagina is one organ which is much better trained to clean itself than your soaps and your reactions.
Yes, yes.
So you do a very short work on yourself, but the vagina itself does the work very properly. Then the dryness, and again, when we receive the complaint, you might be shocked that the dryness is not necessarily inside the vagina, but it is outside here, and probably it's a yeast infection. So now you understand why we might sometimes need to examine. Because what the patient tells you and what is on the ground,
It's not,
they can be two different things. Now, back to issues to do with the liver.
Yes.
First of all, if I answer your question the way you've asked it, I will not do you justice. The reason being, it's not the pons which open. For us, it is the cervix which open. The pons can only be a limiting factor. And what you are probably describing is that towards the end, in such a situation, I mean, doctors sometimes are, they are not good in communication. They might communicate something that the patient lives with, and it's probably not right. So delivery is a fact of, socially we say 4 P's. There's a passenger, there's the passage, there's a psych, and there's the position. I mean, how the baby is positioned. So the passenger lies across deliveries typically. The passenger has to align towards the passage. I mean, if you have something which is like this, and you're going like this shoulder will definitely hit somewhere. I mean, and this is something that our patients should listen to us. I mean, some patients have lost trust with the doctors. And me, I have a very simple way of allowing you. If I explain to you and you feel like, I want to make money, that's why probably I want to take you to theater. So long as the baby is okay, I'll give you a chance to experience what you want. Yes.
To try.
Yes, if you really feel you should try.
Mine
is to take care of the baby and ensure the baby is okay. But this is the reality. Even that trying is actually part of what we should do. Because sometimes some things change. But the reality is, if the passenger is not going through the passage, there is a problem. And the passage is different. There is entry and exit. The entry point, yes, the head can enter. The exit can have a challenge. Or rather, in the middle, the head can get stuck. So that's why we assess you in frequent times. So the explanation here is for you to probably undergo another intervention, including cesarean section. It is either the passenger is not descending, we are together, or the passage is not opening. And we have ways of determining that. I don't know whether I've answered your question. I'm really struggling.
Yes.
Okay.
Thank you, Dr. Harry. Thank you so much. If someone is wondering how they can find you, would you mind sharing your number? I know we had said MTRH, but it's good if you have the number so that they can engage you directly in case of further questions. So when we began, we said that we are empowering a woman to empower a generation. So we do not expect excellent women to be going Googling and buying medication. We need to empower our women out there and our colleagues, the women around us. So we were doing this because excellence is sharpening your skills. We need to sharpen our skills, and we need to be empowered, have knowledge on what is going on around you. So a woman must not only pray spiritually, she must also understand her body intelligently and intentionally. Ignorance has caused fear, shame, and silent suffering among many women. But knowledge gives dignity, confidence, and proper stewardship. An excellent woman is spiritually sensitive, emotionally healthy, and physically aware. And that is who we are, the excellent women. So thank you so much for your time. I know it's already 6:06. Thank you so much for attending. Thank you so much for listening. Thank you so much, Daktari, for your time, and for the whole team for preparing this. I know we are now on another level. The knowledge is on another level, right? Yes, thank you so much.
So maybe before you completely close, in your introduction, I see patients in two places. That's MTRH and also Fountain Healthcare. Fountain Healthcare is near Rupa Mall, next to Lion School.
Yes.
I'll prefer that you get there and book,
Yes. Okay.
but if it becomes necessary and very important, I leave my contact with Pastor Patricia
Okay.
for purposes of that kind of interaction.
Yes.
Thank you.
Okay. Thank you. Thank you, Daktari.
Celebrate Dr. Mogeni and Gloria for the first time. Kindly, Dr. Mogeni, you can just